I'm Leela Thakra, community pharmacist based at Shaftesbury Pharmacy. I'm today talking about the various side effects on oral health due to prescribed medications and even simple over-the-counter purchased medications.
We asked Leela to walk us through the different oral health side effects that common medications can cause, starting with the most common and then working our way up to the rarer side effects. If you are at all concerned about any of the things mentioned in this video, please discuss them with your healthcare professional or talk to your local pharmacist.
So one of the most common side effects of a lot of medications is dry mouth, and it starts with simple over-the-counter medications for cold, such as Benylin, Sudafed, Nurofen for flu. Most of these have a drying agent called pseudoephedrine or phenylephrine, which tends to dry your nostrils and dries your cold out, but at the same time it dries your mouth out as well. Other medications, which is possibly one of the other most common prescription drugs, are inhalers. Using the inhaler correctly is crucial. If there's incorrect usage and if the technique isn't correct, you will have dry mouth, and of course dry mouth will eventually lead into infections. So ensuring that the inhaler is used correctly, you need the support of a pharmacist, and ensure that the pharmacist will show you how to use it, because that is the initial starting point of using an inhaler. The other medication that tends to dry your mouth out are generally known as antidepressants or mood enhancers. Something as common as sertraline, citalopram, fluoxetine, which is the old Prozac, mirtazapine. All these tend to dry your mouth out, but it's a risk-benefit ratio. Dry mouth is just a simple side effect, a basic side effect. One shouldn't give up on your medication because it's important to continue, because again, as I said, risk-benefit ratio. If it's helping you enhance your moods, if it helps you makes you feel better, then please do not give up on any of the medication. Always talk to your pharmacist and of course your dentist to see how severe the dry mouth is, because there's always treatment for dry mouth. The other common medication is used for Parkinson's. As much as it's important to continue with the treatment, that shouldn't be stopped, and if there are any side effects such as dry mouth, do speak to your pharmacist, because there are options available to treat the dry mouth, but the medication should not be stopped abruptly. Antihistamines are used seasonally between March and September, and very common over-the-counter purchases and often prescribed by GPs as well. Unfortunately, a side effect of antihistamine is dry mouth. It's very important to treat the dry mouth but continue with the antihistamines. One of the most common medications for blood pressure is Ramipril. A super drug, helps get blood pressure down, however has a few side effects, and one of them being dry mouth, but that's treatable, manageable. Very crucial not to stop any medication for blood pressure, because it will affect your cardiovascular underlying medical condition. So one of the common side effects of inhalers is oral thrush. And how do you get thrush from inhalers? Incorrect usage. Gone are the days of simple inhalers where you just breathed in and breathed out. So the original inhalers require just simple breathing in and breathing out. However, the newer ones have a technique that's very special. They need to have short, quick breaths taken in and held for a while. So it's very important to ensure that the powder goes into your lungs. So talking to your pharmacist or a specialist in your surgery, just to ensure that the technique is correctly used. Otherwise, it's not going to help with the asthma, and it's also going to cause the thrush that we're trying to avoid. So the first time you're issued an inhaler, talk to a pharmacist or a trained technician in a pharmacy who will take you into a side room and explain to you either with your own inhaler or with a dummy inhaler. So there's certain medications that will change the taste in your mouth, and it can be quite frustrating. But the common drugs that cause the taste in the mouth or the altered taste in the mouth are even a simple antifungal which dentists will prescribe. So although the dentist may give you something to treat an infection in your mouth, it may give you a funny taste in your mouth. Important with some of these drugs, especially this one, is to avoid alcohol and to complete the course, because it will just reduce the side effect. So epileptic drugs, very common, used a lot by a lot of epileptics, tends to give you a funny taste in your mouth. Important thing is to carry on with the medication. As mentioned before, risk-benefit ratio, to stop the medication because you have a simple taste in your mouth that's bothering you, will affect your treatment regime, and it should not be stopped abruptly. It's very important to continue with the treatment, and if you need to reduce the dose or stop it, always speak to your prescriber. Gout medication needs to be taken every day. Any disruption will affect your treatment. Unfortunately, one of the very minor side effects is altered taste, but it's very important to continue with the treatment. There should not be any disruption in the regime, because the altered taste can be treated. However, the gout will come back if you stop the medication. Nicotine chewing gum. Although this is a lozenge, both the lozenges and the chewing gum will give you some kind of a funny taste in your mouth. So that can be camouflaged, that can be treated, but it's important to give up smoking if this is the aid you need to give up the smoking. Transplant drugs, not commonly prescribed, but it's still used by a number of people, and it does tend to affect the taste in your mouth. So crucial to continue with the medication. There should not be any disruption in the treatment regime, and if you do decide to change any of the dosing levels, speak to your prescriber or your pharmacist. We get a lot of requests for treatment for mouth ulcers, and these can be caused by certain categories of medications, and one of them is methotrexate, which is an immunosuppressive drug. Important to continue on with the medication, no disruption in the medication regime. Another one that causes mouth ulcers is an antibiotic that's prescribed regularly, not only just by GPs but also by dentists, is the basic penicillin. So again, important to complete the course, but no disruption, even though there may be some kind of a side effect, which talk to your pharmacist and they'll be able to help you with the side effect. Aspirin tablets, they can cause mouth ulcers as well. Go for the coated versions because it goes past your mouth and there's no disruption to the inside of your mouth. So aspirin is again a very common one, used for simple over-the-counter treatment or even part of your cardiovascular treatment. So sore mouth can be quite frustrating, not comfortable, and anyone with underlying medical conditions such as diabetics, kidney disease, even smokers have a higher risk of having sore mouths. Methotrexate, an immunosuppressed drug, causes unfortunately discomfort and pain in your mouth, but again, said before, important to continue. And any smokers, please take an effort to quit, because your pharmacist will guide you and will assist you and give you the treatment options that are available that they can purchase over the counter. Gingival growth is a very common side effect of a blood pressure category of medications, and amlodipine and nifedipine are one of the most commonly prescribed drugs. Important to continue on with the medication, no disruption in the treatment regime, and if you have side effects, they can be managed. Another common side effect of an epileptic drug called phenytoin, but the side effect is gingival growth, and important to continue with the medication and no disruption in the regime. It's very important to continue with the medication regardless of the side effects, and the issue I have with a lot of patients who will not tolerate simple side effects like a bad taste in your mouth or thrush, and they will return their prescribed medications, therefore disrupting any treatment of their very serious underlying medical condition. So it's very important to either talk to your dentist, your pharmacist, or your GP if you have any issues regarding side effects, because they can be managed and they can be treated.